Hi, I'm Dr. Kenny Levine with Health Talk. I'm back here with Dr. Andy Wasserman. Andy, talked about children and infants. At how young? What is your youngest patient?
My youngest patient is my son. My wife we had a tough time conceiving my son. And eventually she got pregnant. And upon birth, the OB handed me the baby. His best friend was a chiropractor. He said, "Here, you know what to do." I'm thinking I'm holding my brand new son, the first boy born in my family since me, 31 years. I'm petrified. And I said, you know what, I'll do what I was taught to do. I gave my son a very light, very easy movement of the cervical spine. He's my youngest patient.
Gotcha. So just moments old.
5, 6 seconds old.
Is that craniosacral therapy you're talking about?
No, I worked in the upper cervical spine at that point.
Uh-huh. Okay. You know, our youngest patient in my practice, I think to date, is 3 or 4 days old.
Wow.
They're referred to us by lactation consultants, and we do a procedure to free up a tongue tie so the mothers can nurse properly and the children receive nourishment. Okay, so let's fast forward more than a couple of moments old, and now we're talking about young children.
Right.
Okay. What type of problems do young children have that you can address for them?
Well, you know, chiropractic can address a wide variety of diseases, conditions, but we focus on neuromusculoskeletal problems. So the kids that we see usually have, either if they're very young, maybe 4 or 5 years old, they'll wake up one day with a wry neck or torticollis, which is just really a bad muscle spasm in the neck. And we can work on that through the different therapeutic modalities. We also see a lot of kids from sports injuries from age 6 or 7 to their teenage years. And we see a lot of the kids from the high schools and the travel teams and figure skating, golf, soccer. I mean, you just name the sport, we've seen it. Horseback riding, all sorts of things down here. So we treat a lot of children, boys and girls. We also do rehabilitation and performance training in our office.
So you can make them better at what they do?
Better athletes.
Better athletes.
Better athletes through better function.
And none of those bad medicines?
No medicine. We don't dispense any medicine. We don't do any surgery. There's no ill effects. And in fact, they could do a lot of exercise on their own. We give them homework assignments to do at home, at the gym, on the field.
We're going to talk about athletes in a minute, but let's talk about your relationship with the other medical specialists in the community. How do you function with the orthopedists or the patients, family physicians and things like that?
Well, yeah, we've been really fortunate. We've been in practice 28 years. I've been in practice 20 years in Coral Springs. We're the longest standing practice in the city. In all that time, I've had the chance to meet a wide variety of specialists and primary care physicians. And they've gained confidence in us because we have a really valid way to approach problems. They know that we're truthful in our information to the patients, and we get generally very good results in a short period of time. So we have a good relationship with orthopedists who we refer some patients to when they have surgical needs. We have good relationship with pain specialists. When we can't get somebody better, they may have a disc herniation or spinal stenosis. We may refer them to a spinal pain specialist. We have neurosurgical consults who refer back to us for post-surgical care. And the general specialists, we get ENTs that refer to us for vertigo that don't even know us. They said, just go to a chiropractor. They find us, and we treat vertigo occasionally. I can't say that everyone's going to get better, but a lot of them turn out to be very positive.
Is there more than one doctor in your practice?
We have actually 3 doctors, 3 chiropractors. I have Dr. Krasminski, who's from Buffalo. He's been with me 12 years. And we just added last year Dr. Brian Casey, who is from Columbus, Ohio. I would say he's not a specialist, but he spends a lot of time on sports injuries and specifically golf performance.
Well, I got to see him.
Yeah.
He can make my golf better?
He can make you functionally better.
Okay.
The good is up to you.
Okay, that's good. And you and your 3 partners, you talked about him being a golf specialist. Do you all do similar things other than that?
We practice similar styles, so we complement each other. We all bring different things to the table, whether it's adjustment style, soft tissue modalities. We do certain things like that called active release technique, which is a soft tissue modality that's used by the best athletes in the world. We do grasping technique that's good for scar tissue. A lot of athletes and runners and dancers use that. We also do a performance technique called functional movement screen, that all the teams in the United States and across the world use to assess the athlete's biomechanical weaknesses. So we all do these things. We could all assess the patient, and we all could give them rehabilitative exercises.
We're going to get back to the professional athletes in just a moment, because I have a little bit of history that way. It's Dr. Kenny Levine with Health Talk. We'll see you in a minute. Thank you.